The inquiry into Limpopo Premier Dr Phophi Ramathuba's conduct has been postponed until August of next year, when the Health Professions Council of South Africa will present another witness. Sharon Ekambaram of Lawyers for Human Rights argued that Ramathuba's comments in August 2022, when she was still Health MEC, were actually unethical. The remarks captured on video claimed Zimbabwe does not fund its nationals' treatment in Limpopo hospitals and that they were actually burdening the South African healthcare system. Ekambaram said the comments could be interpreted as xenophobic and fuel anti-foreign sentiment.
The inquiry into the conduct of Dr. Phophi Ramathuba took place in Tshwane this morning. This inquiry comes after organizations such as the Helen Suzman Foundation, Section 27 and Lawyers for Human Rights lodged a complaint against Ramathuba to the HPCSA. The organizations are basically saying Ramathuba's conduct in 2022 was very unethical. This is when Ramathuba was addressing a patient at the Bela hospital, and in this video Ramathuba was heard basically telling the patient how foreign nationals are straining the health system. Ramathuba, of course, did ask the patient why was she not with Mnangagwa, who is the Zimbabwean president. Just basically they're saying that the patient should have gotten medical help from her own country. Today we did see Sharon Ekambaram, who was representing the Lawyers for Human Rights, taking the stand, basically telling the inquiry that what they think is that Ramathuba was very aware that the video was being taken, and if she was not aware, the least she could have done was distance herself from the video or call out whoever that posted the video, but instead she didn't. And human rights, the Lawyers for Human Rights in this matter are saying that that video helped to spew hate against foreign nationals, and it helped those with xenophobic comments to continue being xenophobic against foreign nationals. But the legal representatives of Ramathuba, of course, did say that when she comes to the inquiry, she will tell the inquiry that she was not even aware that the video itself was being taken, and of course that her intention was not to spew hate on anyone. The lawyers even asked today, asked Ekambaram whether she is aware that Phophi Ramathuba herself even helped other Zimbabwean nationals who got into an accident while they were in Limpopo, just to show that she was not a xenophobic person. But Ekambaram did say that they are not saying she's xenophobic, but instead they are saying she was very unethical and she should have at least called out those who were being xenophobic based on the video. And they are still saying that Ramathuba could have been aware that this video was being taken because, of course, that she was not alone at that hospital and there were other people that she was with. So it would be very naive to think that she wasn't aware. Of course, HPCSA also did ask some questions to Ekambaram this morning, asking her basically what she thinks, what they think rather as the organization, the effect of this video was and what needs to happen in this regard. And this is where Ekambaram indicated that this broke the ethics basically that go with HPCSA booklet, and she did indicate that doctors have a certain way that they need to conduct themselves, not only in hospitals but also on social media, and Ramathuba failed in that regard because she should not be seen as someone who can shout at patients, as someone who can be rude to patients. And you must remember that this inquiry, Ramathuba, before this inquiry rather got underway, Ramathuba did try her luck at least once at halting this inquiry, going as far as the courts to say that it should not go ahead. But the courts made it clear that she should stand and face this inquiry because she is still registered with the HPCSA. Her argument, among others, was that she was making those comments as an MEC of health and not as a doctor, but the court did find that those two are not mutually exclusive and she should have been more responsible with her comments. Of course, now the inquiry has been postponed to next year, August.